Hi, welcome to the Conservation Nation Speaker Series. This is our second one in our series, and I'm so excited for this conversation. I'm Lynn Mento, and I'm the CEO of Conservation Nation. We're a nonprofit organization dedicated to saving wildlife and their habitats and bringing a more inclusive, diverse, and representative core of conservationists to the fight. So, this conversation I think is going to be fascinating and it's so timely and so relevant. The topic of today's conversation is around One Health, which is the intersection of human health and animal health. And I have with me two incredible people to lead this conversation and provide thoughts and ideas and insights for you on this critical topic of One Health. So, One Health is, you may have heard about it. And the idea of One Health is that we are all connected. We have, as humans, we are living closer and closer to wildlife and their habitats. And as we're encroaching into their habitats and taking their space, we are picking up illnesses and diseases from the wildlife. And those are showing up as pandemics and global pandemics. So certainly, it's very timely and relevant because we're all in the middle of one right now on COVID, which is a zoonotic disease that jumped from an animal to a person because of our encroachment in their space, poaching and trading. But this has happened many times before, most recently Ebola, SARS, AIDS. All of those are zoonotic diseases that jump from wildlife to people. And there's a fight and a focus on how we can stop the next pandemic from happening, from jumping from wildlife to people. And it's, as you can imagine, complicated, a very complicated question and complicated solutions. And I am thrilled that we have someone here to talk with us about that side of One Health. We have Dr. Suzan Murray, who is a world renowned conservationist, and she is the head of the Smithsonian Conservation Biology Institute's Global Health Program. She also, as a board certified zoo veterinarian, acts as SCBI's chief veterinary medical officer. And I've known Suzanne for years. She leads an interdisciplinary team that's engaged in saving wildlife around the globe and hoping to combat infectious diseases of global significance, including these pandemics that we just talked about. So I am thrilled to have Suzanne here to talk about that critical part of One Health, how these diseases are going from animals to people and what that means for all of us. We've seen the impact just now and what that means for all of us. So very happy to have Suzanne here. And I also have Dr. Deborah McCauley here. And Dr. McCauley is a wildlife veterinarian and executive director and co-founder of the Veterinary Initiative for Endangered Wildlife, or VIEW. In her 10 years at VIEW, she's worked in countries around the globe saving endangered animals. She's a graduate of the Royal Veterinary College and has won numerous global leadership awards, including the Ashoka Fellowship and the Emily Corrick Women's Leadership Award recently. And I am just thrilled to have my friends, Dr. Suzan Murray and Dr. Deborah McCauley, here for this conversation around One Health. Now, for those in the audience, we're going to have a conversation. We're going to chat back and forth about a couple key questions on this critical topic, and you can ask questions. So if you go to that chat function, you should be able to press it and type in a question. If you're full screen, you have to get out of full screen to do that. And we'll try to get to as many questions as we can. So I think that takes us to where we're going to focus now just on One Health and then asking the questions. So on One Health, we have this encroachment that we talked about of humans into wildlife space and the impact to us from pandemics. We are also impacting wildlife. So as humans are moving into wildlife territory, as you can imagine, we are bringing diseases and issues and problems for the wildlife. And what's happening is that by encroaching, we are losing wildlife. And we have Dr. Deborah McCauley here who's going to talk about this side of One Health, this issue of how humans are bringing diseases to wildlife and what that means in terms of saving threatened and endangered wildlife. And she and VIEW are doing some incredible breakthrough work there. So I think that's going to be terrific. And then we'll probably talk a little bit about, poaching and trading and all of these terrible things that are happening right now. And you will hear some stories, I'm sure, from these fascinating ladies because they've got a million stories. Some of them I've heard over drinks of their times out in the field and what it's meant and the animals and the people that they have met. So I hope we have a fascinating conversation. So with that, I'm going to move it over to introduce Dr. Suzan Murray and Dr. Deborah McCauley, and then get into some of our questions. Hi, ladies.
Hello,
Hi.
thank you.
Hey, Lynn.
Hi. So glad you're here. I think this is going to be a terrific conversation. So I'll ask questions, and I'll direct the questions to someone, but pop in either one of you with a perspective on them, because I know although you're bringing two different sides of the One Health world to this conversation, you are clearly holistic One Health practitioners. And so jump in, add thoughts if you have something relevant and interesting to share. And again, for folks who are watching, feel free to put questions in the chat that we can ask of Dr. Murray and Dr. McCauley at the end of this. And I am going to switch to first names now, because I know you as Suzanne and Debra. So we're going to go from there.
Great.
So I'm going to start, Suzanne, with a question for you that is probably on everyone's mind. So clearly, COVID-19, fresh in our thoughts, in our hearts, for some of us still in our bodies. And this has been a global pandemic. And this is an example of a pandemic that has arisen from animals. And you have been sort of talking and warning, raising a flag about this, among with others, for many, many years now, speaking at the White House, Congress, Davos, in front of some of the world's most influential people, saying there will be more of these pandemics coming. They're going to come from animals, and there are steps that we need to be taking. It didn't help us this time. But I'd love for you to talk a little bit about COVID-19, what you saw coming and what animal you believe it came from. Give our viewers some insights into this concept of a zoonotic disease jumping from one animal to one person and then causing a global pandemic.
Oh, Lynn, thank you. That's so much to actually address. So I'll do my best. And if I leave a piece out, please circle back and say, oh, you forgot to answer that part. The first thing, as Deborah was saying, I liked your introductions of both of our work, because I think that although Deborah and I might approach something, our job descriptions might approach something a little differently, I think there's a tremendous overlap. And that's one of the things we've been talking about. And the whole idea of One Health, it's such an intercollaborative thought paradigm that if we're going to succeed in saving species, whether it's humans or animals, we do need to think collaboratively and engage as many partners as possible. So thank you for having us here, and thanks for the really nice intro. In talking about COVID, yes, there's been a lot of groups that over the last 10 years have been looking at the frequency with diseases are emerging in the wild, and we do know that they're emerging more and more quickly and more frequently, I would say. And there are steps that we can take to identify and prevent these things. And to some extent, we've had a lot of these steps have been taken. And if we hadn't been working in this arena for the last 10 years, I think if you can imagine it being much, much worse than it is, I think it would have been much, much worse. So, but some of the things that we've learned over the last 10 or 15 years is that we can't look at every species everywhere for every illness. We need to prioritize and use our resources wisely. So we have really tried to think about what are the hotspots around the world, what are some of the drivers of disease emergence, what are the species that are most likely to carry viruses that can jump to humans, and that's bats, primates, and rodents. And what are the viruses that they carry that we need to look at, because there's so many. So we've learned a lot, and COVID does, as someone who's also had COVID myself, that just before vaccines were available, just such a devastating disease. And so much of what we do depends on reaching people, about being able to communicate our science to the public through venues such as this. So that's just a brief introduction, but that's how I would start out with what I'd start out with.
That's terrific. And for someone who knows nothing about One Health and a newcomer to this concept, can you just explain what happens, how this animal, let's say a pangolin, we're looking at pangolin scales, but it could be a bat, it could be a rat, any of the other mammals you mentioned, how a pathogen can go from an animal to one person and then create a global pandemic?
It really varies so much how illnesses or pathogens can skip, move from one species to the next. And that's one of the things that we look at too. Initially, we were just looking at what viruses are out there, Now we're including a behavioral component, like what are people doing to put them in harm's way? And so that's really important too, and identifying the risks. And then after that, trying to identify some of the low cost interventions. So the risks might vary, do vary from country to country, community to community, and they might be different in Asia versus Africa. Whereas in Asia, there's a preponderance in some of the markets are more like live animal markets where animals can come to the market while they're still alive. And that presents a chance to put species that have never been in contact before into very close contact. And that gives a ripe opportunity for illnesses to spread. And then in Africa, some of the larger dangers are like the bushmeat trade. So what to answer your question though, when illnesses spread, it's typically when species that haven't been together before come into close contact, either respiratory or bodily fluids. And then not all viruses have the ability to just transform and go from person to person. One of the crazy things about coronavirus is that, and influenza virus and some other viruses, is that they can adapt very, very quickly. And that's one of the reasons why we have new flu vaccines every year, because the influenza virus can adapt quickly as well.
That's terrific. And you had, I know in working with you, some of your folks, you mentioned, sort of social science, behavioral components. That's so critical to this work. And I know some of your folks in the past had worked with women, I want to say Myanmar, but I could be wrong, who were with their children, going into caves to harvest bat guano because it was their source of income. And yet at the same time, put them at tremendous risk of catching a pathogen. So is it fair that that's one example of a behavioral piece that needs to be part of this One Health component?
Yeah, Lynn, there's so many examples like that. Yes, going in and out of the caves in Myanmar, without a doubt. We also have situations where, some of bats are rather large and they provide really good protein for families. And it's not necessarily eating a bat in a restaurant. It's perhaps the people in the back who are preparing the animal that have the most risk. And then the other part of it, if we think of it on the conservation perspective, it's really critical for us not to think, oh, bats are terrible. Let's save people by going out and killing a lot of bats. It's actually quite the opposite. How do we learn to live safely with bats? Bats are incredible pollinators. They kill tons of mosquitoes. They eat mosquitoes every year so they can help us prevent diseases like malaria by eating up all those mosquitoes. So bats are really important to conservation. And they also pollinate really important plants in Mexico, like the peyote plant. So anyways, yes, there's all right. So I think that's one of the challenges. Like, how do we figure out what the risks are, and then how do we develop the low cost interventions? So I think some of the things we worked on before is a book that's now in a little pamphlet in 13 different languages on safe living with bats. So it's not let's kill all the bats, but how do we live safely?
Terrific. And that's a great segue. This protection of the animals while we're protecting people is a great segue over to Deborah and your wonderful work at View. So you say that wildlife health is the missing piece of conservation. And I think that's so interesting because when we think about conservation, we think about the health of the novices think about the health of the animals so that they're surviving and the species are thriving. And your point is that we are missing the health of that individual animal and the animals that it is with. And by missing that critical piece of the puzzle, we are running enormous risks in saving threatened and endangered species. So can you talk to us a little bit about that, Deborah?
Yeah, absolutely. Thank you so much, Lynn. So the old way of thinking in conservation was really that let nature take its course. That and we want to do that, of course. We want to keep our wild animals wild, and we want to let and make nature take its course. But the problem is, so often, is that our population has doubled in the past 50 years. Our agricultural animals have increased. For example, Yellowstone National Park now has millions of people and pets and horses and dogs and cats and cattle that drive through the center of these national parks. And so habitat encroachment for people and domestic animals encroach upon the living space of our wildlife. And then, as we talked about, 75% of new and emerging diseases comes from wildlife, but we don't really look at how much we can share disease to our threatened and endangered species. So, and at the same time, conservation has done an amazing job with biologists and conservationists out there giving us the story of these endangered species, getting us to learn about the behaviors and understanding more about the species that live within the conservation corridors. Veterinary medicine and domestic animal, agricultural animal, and zoo animal medicine has increased while conservation has also improved. And so instead of veterinary medicine, just treating problems, we've really shifted toward prevention. And so we founded VIEW because of this missing piece to conservation. One of the things Suzanne said is that we really think about what's the priority of species that are out there. And so although a lot of work is being done now on how that transmission to humans is happening, which is great, one of the missing pieces that I was seeing was how are we protecting our critical species, our endangered species, from diseases that are common to, let's say, dogs that can wipe out a population. Or I've been literally in the field and have watched bighorn sheep, just local populations, 90% die off due to diseases that are shared with domestic animals. And so really we're getting to this phase where there are measures and ways to improve our conservation by including the best practices of veterinary medicine into the field, because it's already been done. On the strong work that's been happening in zoos, I don't have to guess work really necessarily on what diseases can wipe out a population, because there's been a lot of work on disease and endangered species. And there are projects out there, they're individual projects, but our work is really looking at the comprehensive way of going in and prioritizing your species, prioritizing the diseases that can wipe out a full population, and how do you do preventive measures. And so that's where that missing piece to conservation comes from, is literally me being in the field, working in, at the state level, working in nonprofit organizations, and realizing that, wow, there's a big chunk that I know what I want to do is to save that tiger, and I want to save that rhino. And we've found diseases that are shared with tigers, and diseases like tuberculosis that humans have shared, or domestic animals have shared with our threatened species or endangered species like elephants.
There have been some horrifying statistics. Oh, yeah.
Oh, no,
Yes,
I was
Suzanne.
just gonna comment on what Deborah was saying, because I think she said it really eloquently, and that one of the things we're really able to do is start bridging the what we learn about human and wildlife medicine within zoological institutions here, that there, like veterinary medicine has advanced so far, and then how do we bridge that to the wild, right, and help take care of the animals there. And I think that's I think that's a really critical bridge, and I think it's one that you've encapsulated here on this call, having me on that on one end, and how it translates to the information that Deborah gets to do in the field. So I think that's a really important part of conservation for the animal. And then as we're taking care of the animal too, and learning about what illness it has, and what illnesses or what pathogens animals and humans have, we learn a lot more about how to, potentially ways to stop that transmission.
Well said. And Conservation Nation has funded some of your workshops in sharing best practices in Kenya on wildlife veterinary care. Deborah, did you want to add to that?
Yeah, I'm sorry to interrupt. I wanted to just add that biodiversity factor, where it really is the One Health. And when you bring up the health of people, or you bring up the health of domestic animals around, let's say, a buffer zone, you first, and you're also bringing up the health of wildlife. So our approach is saying, okay, maybe this species, this animal species is that we're seeing a lot of rabies, so or canine distemper. So the idea is really to prevent the diseases that in the domestic animal population, which only helps the human health population, because as Dr. Murray just said, we're sharing these diseases, humans, domestic animals, wildlife. And so we're all in this together. And so my work isn't exclusive from Dr. Murray's work. It's really an inclusive work. And biodiversity is really about, we are this one health and we are this one planet.
I love that articulation of One Health. So any of our viewers understand the impact of what you were saying earlier, Deborah. These issues, these illnesses and diseases that we're bringing to wildlife are truly devastating. You have opened my eyes to this. You showed me a horrifying photo of a field of a species of antelopes. Yeah, there's the photo, that were decimated. Something like 75% was decimated over the course of a fortnight, as you say. Can you talk a little bit about what happened here?
Yeah, I often bring up this photo because I didn't have a photo of this when I was literally in the field and seeing this in a different species across the globe. But it's happening across the globe on many different continents, where what you just saw was littered across the landscape, dead and dying endangered species. Conservation efforts spent millions of dollars and many years trying to stop habitat encroachment and anti-poaching measures, and climate change, and yet within a fortnight, 70%, 210,000 animals died within 2 weeks' time. And I saw this when I was in the fields, when working at Fish, Wildlife, and Parks in Montana. Bighorn sheep, I was called off for a die-off of bighorn sheep, and I saw a 90% die-off of dead and dying bighorn sheep. And we diagnosed that those bighorn sheep died of pneumonia. We tested the domestic animal sheep population that was intermingling with those bighorn sheep, and they had a pathogen that was not causing any sickness in the bighorn sheep, but transmitted to the wild sheep population and wiped out the wild population. And that has been happening for decades in local populations throughout the Rocky Mountains in that one species. But I have seen it in other locations, in other continents. And so that really drew why I wanted to start this path. With my partner, Dr. Gretchen Kaufman, we put together a program that really addresses that by threefold way, through really educating the local stakeholders, partnering with the local stakeholders, creating a program for them that they can go on and build their own wildlife health program and replicate that program within their country, within their national parks. But I also found it was really out of seeing that missing pieces, that the people that I was working with, very passionate. Our first project was in Nepal. They also needed the infrastructure. They needed to have laboratories. They needed energy. They needed freezers to collect biological samples. They needed veterinarians to help support the one veterinarian for the whole national park to help collect those samples, submit the samples, see what diseases are out there. So we built, at that point, we helped build diagnostic laboratory. We helped put the seed money for their wildlife health hospital. They now also have a genetics laboratory, all built within their conservation biodiversity center. So our work is never about just, completely isolated and alone. It's including in the conservation hard work that's already being done by the conservationists on the ground. And then we help, always bringing in students, always bringing in women with the work that we're doing, and helping them create research projects that we helped initiate, and now they're continuing on diseases that really most impact their critical species. And so that's how we work, and that's where the premise of the missing piece to conservation came from, was that view really had to develop it in three folds, through education, providing infrastructure, and then helping do research by are partnerships with the government, with a local university, and with the local conservationists, the stakeholders that can then go on and implement those programs.
That makes a lot of sense. And we're big believers too in building this next generation and uplifting voices, as you were saying, right there with you, Deborah. Let's talk a minute about.
Just quick, what I thought was really amazing, because things happen as a secondary, and Ashoka came to give to see if we were really the only group that was doing this whole comprehensive program. And it was really neat, because when I was walking around in the parks, I didn't say a thing, and it was the guides that came in and said, the biggest threat that we have today in Nepal is our disease component. And now we're really, this is a huge threat. This is something that we're including. And then our veterinarians were replicating and sharing the knowledge, not only with other veterinarians and veterinary students, but with the local community. The veterinarian that we hired would go around to the local community and share conservation work with their conservation, biodiversity center, other biologists, but also that message was important, that the local communities also understood that diseases that your dog may have, rabies that your child could possibly get, can also hurt, the wildlife, or canine distemper, or, cattle. So that was also a component, an added component that I wasn't necessarily thinking initially, but now we definitely include.
Love that, the focus on education and prevention. And let's, Suzanne, let me go over to you on coming off of that thought. So as you are hunting with your team for the next potential global pandemic, this next pathogen, and where it might arise, from what species and what place, and through what mechanism, where are you focusing your efforts? Because everyone has, limited resources. Where are you focusing your efforts? And then what's the value of finding it? So let's say you find something that looks really dangerous to you in a certain bat. What do you do with that information that at the end of the day could save a grandmother in Omaha? How's that happen?
Yeah, well, that's a great question, Lynn. And I think there are several different facets of that I'll try and hit upon. So we are focusing most of our efforts in East Africa, especially Kenya, although we're working in other countries as well, in West Africa and Southeast Asia as well. One of the things that we've learned, and it's very similar to what Deborah was saying, how important it is to include the community. So we typically, where we work, before we start doing anything, we will often identify hotspots through modeling, or where an outbreak might be. We've been in Kenya for a very long time, for several decades, so we have really good relationships with the Kenya Wildlife Services, but also Ministry of Health. So we can work with the community so they have an idea of what we're trying to do and what we're trying to identify. We'll collect biological samples from animals, and in some particular studies where we have permission, also working with MDs in humans, with MDs to look at human samples. And one of the laboratories which we trained in, the folks that we've trained in Kenya, IPR, Institute of Primate Research, is this tremendous laboratory that is now one of the premier COVID testing laboratories in Kenya. And then we also work a lot with Pala Research Center, which is a really great research station and has field laboratories and as well. So the idea would be to collect the samples in a safe way. It's really important for everyone, because we never want to put animals or humans in harm's way. So getting the appropriate biological samples in the safe way, getting the samples to the appropriate laboratory, and then when the testing comes out and we start analyzing the results, then there's a really important communication trail that typically is set up prior to any the onset of any training. Meaning, we have to think about, what if we find something that can really spread rapidly? We need to have those agreements in place. So one of the things we had worked on a lot previously was just that the communication chain and the between the all our governmental partners. So if we do find something like a new Ebola type virus, that can get moved along and released very quickly, so we can warn people. And if we have something that appears to not necessarily be a critical threat right then, but something that we'd be looking at in the future, that's an opportunity for us to share through scientific methods, conferences, and publishing papers and doing things online. One of the things that I feel like has been a little bit of a gap in the past is also connecting with the American public. We've connected directly with a lot of the communities and the public in the countries in which we've worked overseas, but I feel like sometimes the story, or we haven't been as effective as possible as in terms of uh, connecting with the American public. I feel like if we had done that ahead of time, people would have known, what a virus, what Corona was ahead of time. There wouldn't have been any time lost thinking, oh, maybe it's a hoax. We would have been quicker to, develop the relationships to pass along the really critical genetic codes that we're finding in the field to the pharmaceutical companies to make the vaccine. So and we said this right in the beginning. I think Deborah said it. Thank you for giving us this venue, right? This opportunity to talk about some of these critical issues online, so we can reach people. We're also part of this really terrific team out of UC Davis called the One Health Workforce, and part of that is also about including, being more inclusive and sharing our findings with communities. Oh, one other thing I'll say that I really like, and I think Lynn, you've seen pictures of. With our partners at the Museum of Natural History, there's an outbreak exhibit, and that exhibit is all about emerging threats, and it's a really terrific exhibit to go visit. However, in addition to visiting that one exhibit, they've developed this really unique idea, which I think is something we'll use more and more. It's like a take it on the road or do it yourself exhibit, where scientists around the world can work with Sabrina Schultz is the curator of that exhibit, to have specialized panels for that country that work on the risks involved, the different animals, the species, the different pathogens. So we've done that for Kenya and Myanmar, and then you can take these panels on the road to different communities and say, this is what we're doing, this is what we found, this is your input, and this is what we can do to help keep you safe. So I have found that to be a very, very nice way to knit things together internationally, and in the field. And I think what you're doing for us now is giving us nice opportunity to knit it together here as well.
I've seen those panels and they are terrific. I've seen them in action. So I agree with you on that. And I want to get back to Deborah, but just a quick follow-up question, Suzanne. It's so interesting how you talk about the intersection with the pharmaceutical industry and how what you're finding can help further that cause. Are we at a place where if you and your team and others identify a new pathogen that you believe could become a global pandemic, that the pharmaceutical industry can get a jump start on the vaccine? Is that possible?
You are reading my mind, or either that or I planted that question, because I feel like that's really one of the, like when you think of a low hanging fruit, I'm like, wow, if we could connect with these pharmaceutical companies directly, and if they realize some of the field forward diagnostics that we're doing now, like getting those samples, and then even sequencing them in the field. I mean, stuff can happen really, really quickly, and so. Yes, we've been hoping to connect with pharmaceutical companies and have them help support our program, because if what we're doing collectively, both for our team and Deborah's team, this wildlife health stuff is important. It's important for conservation, and it's important for human health.
Yeah.
And it's important
terrific.
for stopping the next pandemic. So yes, I desperately want to connect with pharmaceutical companies.
That's right. Okay, well, we'll see if we can help. We'll keep our fingers crossed. It's so smart. And both of you have led the most fascinating lives. So I love reading your stories and hearing you speak and looking at your photos. And Deborah, you talk a little bit about how you heli ski into a mountain and ski down and find wolverines and operate with a headlamp in the dark. And I think we may even have a photo of that, of you in action there. So as you've been doing this, I doubt you grew up thinking this is exactly what you wanted to do. Have you ever thought like, man, how did I get here? I love where I am, but how did I get here?
I actually did think of it when I was a kid. I really didn't understand that veterinarians weren't in the field doing wildlife work. And
Mm.
I combined my passions with what I do today. It really was started a long time ago, when I knew that I wanted to be a wildlife veterinarian. When I went to vet school, I was fortunate enough to go to the Royal Veterinary College, which has a health program at the zoo, London Zoo. And I was also really passionate about ultra running. So that photograph you're seeing, I was a 50-mile running national races up mountains already when I started the Wolverine Project, and they had a hard time getting veterinarians to the spaces that I could get to. So I combined I was running nationals that year. Actually, the photograph was taken, and that was taken in the middle of the night, probably midnight. I'd get a call. I'd work in a local hospital doing surgery. I had a great relationship in that hospital that if I got a call from a wolverine, the other veterinarians would take over. I'd go to the trailhead and I'd hike for 8 hours. I'd get to the top of a mountain. I'd meet the team who had identified where the wolverines were, and then I'd implant radio transmitters in the wolverines. And really, it was, if I could, stand back and really think about the work that I've been doing and share that with anyone, it's really follow your passion, have a goal, create a plan, write that plan down every day and follow that plan. It's going to adjust, it's going to change, and surround yourself with just A-plus players, amazing people. I've been so incredibly fortunate to surround myself with, from my family to my friends to the people I work with are all, it's all about view. Sorry, everybody, but it is like my whole world is that. It's always been that. And if you want to follow your dreams, make sure that everybody around you is in tea with you as well. So.
Terrific. Terrific. We only have 5 minutes left. This went so fast. So I want to pull on two threads that you just mentioned, Deborah, and kind of do a quick Q&A with the two of you on a few of those things. So one of the threads is around the advice that you would give to somebody who is interested in helping the cause of One Health, which could range anything from I'm sick and tired of these these plagues that we're suffering from, and I want to do what I can to help, to somebody who's interested in becoming a wildlife veterinarian. One piece of advice, and Deborah, you mentioned some which were fantastic, right? Make a plan, write it down, surround yourself with A players, be prepared for twists and turns. Suzanne, do you have anything on the advice side to add?
When Deborah was saying that, I was nodding along the whole way as well, which is, like find your truth, your inspiration, and follow it. I think I had decided when I was very young that this is what I wanted to do. And my dad had said, I was watching a National Geographic show with Jane Goodall on it. I'm like, that's what I want to do. And he's like, okay, then that's what you're going to do. And I just thought like, you kind of, I didn't, at that age, I just needed someone to believe in me and say, yes.
Yeah.
So I think that the more we can look at young women and young ladies and say, inspire and say yes, the better. And that's not to say that young boys' voices aren't important. Also, they're critically important, but they've just tend to have been heard a little bit more than young women's voices. So I think that's my thing. If we can reach out to young ladies and inspire them and encourage them and say, yeah, as Deborah said, find your goal and pursue it. Keep going. It might not be linear. You're going to need to course correct, but that's what I would say. The more that we can inspire the next generation, the better. And the picture you just showed was of a girls' literacy program in Kenya that a college mate of mine started 10 years ago. And you find like-minded people who are coming together. Yep, that's Lit World in Kibera, Kenya. So complete, just brilliant young ladies and young boys as well.
Yeah. And we at Conservation Nation are so vested, as are the two of you, in youth and inspiring youth and girls and saying, you can do this, you can become this, and we need you. The future, as you mentioned, the future, our future is in their hands. The future of the planet, we will only survive if every smart voice and every smart solution is at the table to save biodiversity. And we need every girl in the room for that.
And I wanted to
Okay.
add two things. Just that education absolutely is key and critical. And then, it doesn't always get easy. It's not sometimes easy, and really to follow that. But then in our position, Suzanne's position, my position, and your position, Lynn, we need to mentor. And, that's a huge part of what we do at VIEW. We never wear it because it's just part of what we've always done. And it's a very key factor of mentoring, women, girls, but also everybody that's really interested in conservation. I want to see so many more wildlife vets in the world out there. And part of my path, as much as I want to do what I'm doing, I'm absolutely trying to create a path for veterinarians to have a job and to say, this is important. Include it into conservation and include a veterinarian in the field in conservation, because critical species need a doctor.
Good, terrific. 1 minute, last question. What gives you hope? Quickly. So, Deborah, you had the floor. What can you name one thing that gives you
That's
hope?
an easy one for me. I can't fight climate change. I am not going to stop poaching, and I am not going to combat large landscape conservation. But I'm a doctor. I can prevent disease, investigate disease, and prevent it. I absolutely believe in my heart of hearts that this absolutely will help save endangered wildlife. And in the past 10 years, Nepal has doubled their numbers of tigers. I have actually been a part of re-releasing tigers back into the wild. I feel extremely proud of what our partners have been able to do in Nepal, and including wildlife health into their work. I'm very excited about the future with wildlife health as part of conservation. Absolutely.
Terrific. And Suzanne, what gives you hope?
The next generation, these young folks that are coming up are so smart. They're engaged. That's what, training the next generation and creating those opportunities for these young voices and previously underrepresented communities and voices to have a voice.
That's right. Diversity, inclusion, and representation in the field of conservation is the only way we are going to win. There's no other path.
Yep.
Okay, ladies, this was fantastic. Thank you so much for your time, Suzanne, Deborah. It was wonderful. I so enjoyed the conversation, and your insights were fabulous. So thank you again for joining the Conservation Nation Speaker Series.
Great.
Thank you for having us.
For folks listening, if we didn't get to your questions, you feel free to shoot something out to info@conservationnation.org. And our next speaker series session will be in May, and we're going to be focusing on rhinos. So we'll have Nina Facion, for example, who is a global leader in rhino conservation. So that should be, and some others, that should be very exciting for us. So thank you for your time. I appreciated it. I hope we gleaned something from this really interesting conversation with Dr. Murray and Dr. McCauley. And I hope to see you again in a month. Take care.